Hi, I'm Alicia. I am going to be doing my presentation on eye movement desensitization and reprocessing, also known as EMDR therapy. Starting off with the history, Francine Shapiro developed EMDR therapy. In 1987, she was walking in the park when she noticed that eye movements were causing a reduction in her negative emotions that were tied to her painful experiences. She then observed that other people also had the same response as she did, and they had reduced negative emotions while using eye movements. She realized that eye movements alone could not be the only thing that guided individuals in their healing process, so she included a treatment approach, which she called eye movement desensitization. To determine the effectiveness of EMD, she conducted a study. This study had 22 participants, and the participants were split into two groups. One of the groups was EMD, and the other was an imagery and detailed description group. The imagery and detailed description group is the same therapeutic process as EMD, just without the eye movements. The study concluded that the EMD group had a significant reduction in negative emotions and an increase in positive beliefs. The EMD group did have greater outcomes than the imagery group. In 1991, Shapiro renamed EMD to eye movement desensitization and reprocessing. Up until this point, EMDR was considered an experimental approach until 1995, when another study about EMDR was conducted. In 1995, a procedure book was also published and an institute was established. Shapiro created an information processing theory. She believed that everyone has an information processing system, which is where our memories are held. The elements of our experiences, which are images or emotions, are what our memory consists of. When we have new experiences and the elements of these experiences are adapted to previous memories, and what is when Shapiro believes that individuals partake in learning. However, when negative or traumatic experiences occur, they obstruct the information processing system, and our experiences are not healthily processed. Instead, memories that are detrimental to individuals' well-beings are stored. So when individuals revisit these memories, or when something reminds them of the memory, it can cause intense negative emotions or physical reactions to occur, or even feelings like the individual is reliving the experience. Shapiro also discusses large T traumas and small T traumas. Large T traumas are those experiences that are seen as more severe or intense. An example would be someone surviving a plane crash. Little T traumas are memories that are less severe, such as being called mean nicknames as a child. However, it is important to note that little T traumas can also obstruct the information processing system and are vital to be explored during EMDR therapy. The role of EMDR therapy is to help individuals process their traumatic and negative experiences. Essentially, it desensitizes the experiences, so the experiences are still perceived as negative, except the individual is able to think about or revisit these experiences without having such intense negative emotions or physical responses. So the individuals are able to develop an adaptive thought process related to the experience, and the information processing system is then able to take place. And the experiences are then stored with other previous memories. Because the client is exploring painful experiences and they're in a vulnerable position, it's essential that a strong therapeutic relationship is established. The therapeutic relationship is also important because it influences the outcomes. Shapiro believed that a strong relationship allows clients to develop adaptive memories easier than if the relationship was poor. She also emphasized the importance of preparing clients to partake in EMDR therapy. Because EMDR therapy can elicit intense responses, it's vital that the client is prepared and understands the process. The counselor takes an interactive role and is collaborative with the client throughout the whole process. Originally, EMDR therapy was used as a treatment for individuals who had negative or traumatic experiences, but has also been shown to be effective treatment for individuals with depression, anxiety, suicidal ideations, children, sexual abuse victims, and substance use disorders. There have been several studies conducted that have shown the effectiveness of EMDR therapy. I will be discussing a study that used EMDR therapy for individuals with acute mental health crises that were at high risk for suicide. The study consisted of 57 participants. All of the participants received EMDR therapy. The amount of sessions received differ for each participant, but it was between 2 and 32 sessions. The average received less than 12 sessions. The results showed that the participants experienced a significant decrease in depression, anxiety, and suicidal risk. EMDR therapy uses relaxation exercises while individuals focus on painful experiences while using bilateral stimulation. There are different kinds of bilateral stimulations used, but common ones are rapid lateral eye movement, which is the most common one used, tapping stimulations, and audio tones. EMDR therapy aims to decrease negative emotions that are tied to the client's traumatic experiences. EMDR therapy also helps clients process their negative emotions and change their detrimental beliefs associated with their experiences. The process of EMDR has 8 phases. The first phase is history assessment. During this phase, the counselor determines if the client is ready to partake in EMDR therapy. The client also discusses their trauma, and the counselor and client determine the focus of the treatment. Based on the client's past trauma and the client's current trauma symptoms, the counselor creates a treatment plan. The second phase is confirming coping strategies. During this phase, the clients learn stress reduction techniques that are used in the therapy sessions and can be used outside of therapy as well. The 3rd through 6th phase is when EMDR is implemented. The client first identifies the memories that are associated with their target experience. The client identifies negative beliefs about their experience as well as their positive beliefs. Even though the client talks about their positive beliefs, the therapy process does not typically revolve around the positive beliefs. The last thing the client identifies is their reactions that occur while thinking about their experience. This includes their emotional and physical reactions. The client is then invited to focus on their memory and the negative reactions associated to their memory while participating in bilateral stimulation. After the stimulation, the client is told to clear their mind and observe anything that comes to their mind. This process is then repeated several times throughout the sessions. The next phase is the closure phase. During this phase, the client is encouraged to keep a diary and document anything related to this process. The diary is also used to remind the client of the stress reduction exercises that were previously taught. Once this is completed, they move to phase 8, which is reviewing the progress that has been made. The client and the therapist go over all the experiences that have caused negative emotions, including past and current ones. They also make a plan for negative experiences that may occur in the future. And that is all. Thank you for listening to my presentation.